Hello. Hip replacement surgery is an extremely common operation in the UK and is carried out by orthopaedic surgeons. They replace a damaged hip joint with an artificial one. The artificial joint can be made of titanium, cobalt, chromium, or other materials. People usually need a hip replacement when their hip joint is worn or damaged and they can no longer move around without pain. Sometimes people need a hip replacement if they have broken the hip following a fall or accident. The operation is either carried out under general anaesthetic, which means that you are put to sleep for the operation. Alternatively, you may have a spinal anaesthetic. This is where the lower part of your body is numbed by giving you an injection in your back. You won't feel anything from your waist down, but you will still be awake. You may receive some sedation during the operation to help you relax. To replace your joint, your surgeon makes an 8 to 12 inch cut into the skin above your hip. Your existing hip joint and the upper part of your thigh bone, known as the femur, is removed. The remaining thigh bone is then hollowed out. A smooth cup is placed into the hip joint. This is your new hip socket. A metal stem with a smooth ball attached to the tip is fitted into the thigh bone. The metal stem may be rough so that it knits into the bone, or it's secured with a type of cement. The socket and ball move against each other smoothly so that you have less pain and can move around more easily. Modern techniques use a smaller cut into your skin and special instruments to replace the joint, but this technique is currently limited as it's still very new. Recovering from a hip replacement takes time and commitment. You will need a walking frame or crutches for a period of time after surgery. You will need to follow a strict exercise or physiotherapy program to help strengthen your new hip. Everyone is different, but in general, you can expect to return to light activities within 6 weeks. If you have any questions about hip replacement, please speak to your GP or orthopaedic surgeon.